Before you eat breakfast tomorrow morning, there is something important to understand. Many people think strokes happen completely without warning, but in reality, the first few hours after waking up can be one of the most important times of the day for your heart and blood vessels. As we get older, our bodies go through several changes overnight. We spend many hours without drinking water, our blood pressure changes while we sleep, our circulation adjusts as we wake up. And for some people, certain morning habits may place extra stress on the cardiovascular system during this transition period. The good news is that many of these habits are easy to improve. Today, we'll look at 7 common morning habits that may increase stroke risk and what you can do instead. These are not guarantees that a stroke will happen. They are simply factors that may affect cardiovascular health, especially for adults over 60. Small daily changes can make a meaningful difference over time.
Standing up too quickly. The first habit starts before your feet even touch the floor. It may seem like a very small thing, but the way you get out of bed in the morning can have a bigger impact on your body than many people realize. After lying down for 7 or 8 hours, your body is still adjusting when you wake up. During sleep, your heart does not have to work as hard as it does during the day. Your body is in a resting state. Your breathing slows down, your muscles relax, and your circulation operates differently than when you are standing and moving around. Then morning arrives. Your body begins preparing for the day ahead. Your blood pressure starts to rise, your heart rate gradually increases, your circulation begins shifting from a resting state to an active state. All of these adjustments happen naturally. Most of the time, we don't even notice them. However, as we get older, these adjustments can become a little slower. The body's ability to quickly regulate blood pressure may not be as efficient as it once was. This is especially true for people over the age of 60. It can also be more noticeable for those who take medications for high blood pressure, heart conditions, or certain other health concerns. This is one reason many older adults experience dizziness or lightheadedness when they first get out of bed. Have you ever stood up in the morning and suddenly felt like the room was spinning for a moment? Or perhaps you felt slightly off balance and needed to hold on to a nearby chair or wall. Maybe your vision became a little blurry for a few seconds. These experiences are actually quite common. When you stand up very quickly, gravity suddenly pulls blood toward your legs and lower body. For a brief moment, less blood may reach the brain. Your body usually corrects this very quickly by adjusting blood vessel tension and increasing heart activity. But during those few seconds, you may experience symptoms such as dizziness, lightheadedness, feeling unsteady, blurred vision, weakness, or a sensation that you might faint. Even if the feeling only lasts a few seconds, it should not be ignored. For older adults, a brief loss of balance can sometimes lead to something just as serious as a cardiovascular problem, a fall. Falls are one of the leading causes of injury among older adults. A simple stumble while getting out of bed can result in bruises, fractures, or a lengthy recovery period. This is why taking a few extra moments before standing can be so valuable. Think of it as giving your body time to wake up gradually. Instead of immediately jumping out of bed, try sitting on the edge of the bed first. Let your feet rest comfortably on the floor. Take a few slow breaths. Allow your body about 30 to 60 seconds to adjust. Some people may even find it helpful to gently move their ankles or legs while sitting. These small movements can help encourage circulation before standing. After that, stand up slowly rather than rushing. Notice how your body feels. If you feel steady, continue with your morning routine. If you feel dizzy, sit back down and give yourself a little more time. Another factor to consider is hydration. Many people wake up slightly dehydrated because they have gone several hours without drinking water. Mild dehydration can sometimes make morning dizziness worse. This is one reason many healthcare professionals encourage drinking a glass of water soon after waking up. It helps replace fluids lost overnight and supports normal circulation. It's also worth paying attention to how often morning dizziness occurs. An occasional episode may simply be related to standing up too quickly. However, if dizziness happens frequently, becomes more severe, or leads to falls, it's important to discuss it with your healthcare provider. Sometimes it may be related to medication, blood pressure changes, dehydration, or other health conditions that deserve attention. The good news is that this is one of the easiest habits to improve. You don't need special equipment, you don't need expensive supplements, you don't need a complicated exercise program. All it requires is a little patience. Give your body a moment to transition from sleep to activity. Sit before you stand before you walk, and allow your circulation the time it needs to adjust naturally. It takes less than a minute, but that simple habit may help you start the day feeling steadier, safer, and more comfortable.
The next habit is extremely common. Many people wake up and immediately reach for coffee, but after sleeping all night, your body has gone many hours without fluids. You naturally lose water through breathing and normal body processes while you sleep. That means you may wake up slightly dehydrated. When dehydration is present, you may notice fatigue, lower energy, headaches, dry mouth, or dizziness. Coffee itself is not the enemy. Many people enjoy coffee and can safely include it as part of a healthy lifestyle. The issue is making coffee your first drink of the day. A simple improvement is to drink a glass of water first, then enjoy your coffee afterward. This small habit helps replace some of the fluids your body lost overnight. Many people take blood pressure medication every morning because that is how it was originally prescribed. For many individuals, that timing works perfectly well. However, blood pressure naturally follows a daily rhythm. It tends to be lower during sleep and rises again as the body wakes up. Because every person is different, the best medication schedule may vary from one patient to another. This does not mean you should change your medication schedule on your own. Instead, it means asking a simple question during your next medical appointment. Is the timing of my blood pressure medication still the best choice for me? Sometimes that conversation alone can help improve blood pressure management. Doing intense exercise immediately after waking up. Exercise is one of the best things you can do for your heart, brain, and overall health. There is no question about that. Regular physical activity helps reduce stroke risk over time. However, some older adults may benefit from easing into exercise rather than starting with high-intensity activity immediately after waking up. Early in the morning, blood pressure is still adjusting. The body is waking up. Muscles may be stiff, hydration levels may be lower. Instead of jumping directly into vigorous exercise, consider starting with a short walk, gentle stretching, light movement. After a few minutes, your body may be better prepared for more strenuous activity. The goal is not to avoid exercise. The goal is simply to warm up first. Eating a high-sodium breakfast. Many foods that appear healthy can contain surprisingly large amounts of sodium. Examples include packaged breads, processed deli meats, flavored instant oatmeal, and frozen breakfast products. Too much sodium can contribute to higher blood pressure, and high blood pressure remains one of the most important risk factors for stroke. You don't need to eliminate sodium completely. Your body still needs some sodium. The important step is becoming aware of how much you're consuming. One simple habit is checking nutrition labels. Many people are surprised by how much sodium is hidden in everyday breakfast foods. 6. Taking ibuprofen or naproxen every morning without reviewing the risks. Many adults over 60 deal with knee pain, back pain, arthritis, joint stiffness. Because of this, some people take medications such as ibuprofen or naproxen every morning. These medications can be useful when appropriate. However, regular long-term use may affect blood pressure in some individuals. One reason is that they can cause the body to retain more sodium and water. That extra fluid can make blood pressure harder to control. If you find yourself taking pain medication frequently, it may be worth discussing with your doctor. There may be safer or more appropriate options based on your medical history. Never stop prescribed medications without professional guidance, but don't assume that a daily over-the-counter medication is completely risk-free either. 7. Ignoring possible warning signs. This may be the most important habit of all. Many people assume a stroke happens without warning, but sometimes the body sends signals before a major event occurs. Possible warning signs may include sudden facial drooping, arm weakness, difficulty speaking, sudden confusion, temporary vision problems, unusual numbness, sudden severe headache. In some cases, these symptoms disappear within minutes. That does not mean they should be ignored. A temporary episode may be a transient ischemic attack, often called a TIA or warning stroke. A TIA is a medical emergency. If stroke-like symptoms occur, seek immediate medical attention. Do not wait to see if the symptoms come back. Quick treatment can make a major difference. The most important message is simple. Many stroke risk factors are not caused by one dramatic event. They often develop through small habits repeated day after day. The good news is that many of those habits can be improved. Sit up slowly before standing. Drink water before coffee. Talk with your doctor about medication timing. Warm up before intense exercise. Pay attention to sodium in breakfast foods. Review regular pain medication use. And never ignore possible warning signs. None of these habits guarantee that a stroke will be prevented, but together they may help support better cardiovascular health and reduce unnecessary risk. As we get older, simple daily decisions often have a bigger impact than we realize, and sometimes the smallest changes can make the biggest difference over time.